Hi, Dr. Michael Silverstein from Carnegie Women's Health. Let's talk a little bit about people that don't have regular predictable periods. Let's begin with the beginning. Let's begin with the onset of menses. The average age of onset of menses in young girls is 11, 12, or 13. There are these things called secondary sex characteristics that young girls will begin to develop that culminate with the menses. Most young girls will begin with a little bit of nipple elevation somewhere around 8 or 9 years old. About a year later, they'll begin to develop hair in the underarm and in the pubic area. About a year after that, they will have an acceleration in their growth. And about a year after that, most young girls will get their periods. And these all overlap. So the breasts grow until the mature stage for anywhere between 3 and 5 years. As I mentioned, about a year later, at 9 or 10, the hair begins to grow in the underarm and the pubic area, and that continues to full mature hair growth for approximately 3 to 5 years. The growth lasts about 3 years, and with the menses, that's the final effect of onset of menses. Very, very common for girls to get irregular, unpredictable periods for the first several years. However, if that irregularity or absence of menses continues for more than 2, 3, or 4 years, it ought to be brought to the attention of a gynecologist. Many pediatricians are completely aware of the assessment and the workup. Young girls should be made aware that the gynecologist does not need to examine them, aside from heart rate and blood pressure. But there is a very, very simple paradigm to follow for hormonal testing in young girls. To find these hormones in the normal range is very reassuring. And aside from blood tests, they can leave knowing full well that they will develop a regular cycle in a normal amount of time. There are several hormonal disorders that, if addressed early, can be treated appropriately and prevent long-term complications. One of the more common is a syndrome that's called Polycystic Ovary Syndrome, and it causes an imbalance of hormones. One of the hormones that triggers ovulation is made in excess, and it throws off the ovulation. So the follicle develops on the ovary, but the ovulation doesn't happen. When left unchecked, after years and years, multiple follicles still develop on the ovary, and that's where it acquired the name Polycystic Ovary Syndrome. So it's not as a result of polycystic ovaries, but the ovaries become polycystic as a result of the hormonal imbalance. And professionally, one of the more frustrating things is to have a woman come into the office in her late 20s or early 30s stating that she's always had irregular, unpredictable cycles. To make a diagnosis of polycystic syndrome after 10 or 15 years of irregular, unpredictable periods is a lot more difficult and a bigger challenge to treat than making that diagnosis early in a girl's life. Other causes of irregular or unpredictable bleeding should be addressed also by a gynecologist. But until 21, a significant majority of women are not going to need an exam by a gynecologist. Clearly, with onset of sexual activity and contraceptive counseling, I think it would be merited. But pap smears or screening for cervical cancers don't begin till age 21. Other points in a woman's life where menses can become irregular can often be with other medications that she might be taking. Many women who take birth control pills will skip their periods altogether or bleed excessively lightly, and that's a completely normal manifestation of birth control pills. Clearly, anybody skipping their period ought to do a home urine pregnancy test, because one of the commonly neglected causes of skipping a period is unplanned and or undesired pregnancies. So checking a pregnancy test is very useful as a first step after a skipped period. Finally, skipping a period is not so abnormal. A skipped period with a negative pregnancy test is almost always followed by a regular, normal, predictable period. There are lots of episodes in a woman's life where she might skip a period. Sometimes it's under large amounts of stress. Sometimes if a woman is exercising more than usual. Sometimes if there's been a lot of weight gain or weight loss. So there are lots of sources or a lot of etiologies for skipping a period or having an unpredictable cycle, but clearly it warrants a discussion with your gynecologist, and we at Carnegie Women's Health are very eager to engage in this conversation and head you on the proper path for the discovery of the etiology and the management.